Hi, my name is Amber Terhune. I'm the health educator for the Johnson County Health Department. This presentation is about asthma. Asthma is a chronic disease that affects the lungs. Inflammation and temporary narrowing of the airways makes it harder for air to move in and out of the lungs. It is one of the most common long-term childhood diseases. Asthma affects adults as well, as it may carry over into adulthood or may not even be diagnosed until adulthood. Asthma can evolve into COPD over time due to chronic inflammation and airway restriction. About 26 million Americans have asthma, and more than 7 million of those are children. It is the third leading cause of hospitalization among kids. Here is a chart showing the asthma prevalence percentages by age, sex, and race or ethnicity in the United States in 2015. It was 8.4% for children and 7.6% for adults, 6.5% for males and 9.1% for females, 7.8% for whites, 10.3% for blacks, and 6.6% for Hispanics. In the United States, 33.1% of adults with asthma and 15.9% of adults without asthma reported fair or poor health in 2015. In Indiana, 40% of adults with asthma and 16.3% of adults without asthma reported fair or poor health in 2015. Doctors do not know the exact cause of asthma, but here are some associated risks. There may be a family history of asthma or allergic conditions, or the genetic makeup may make someone more susceptible. They may have allergies such as food, environmental, or animal. They could also have eczema or atopic dermatitis and hay fever or allergic rhinitis. In children, boys are more likely to have asthma, whereas in adults, women are more likely to have it. Smoking damages lungs and the airways, and it allows dust and mucus to accumulate in the airways. Maternal smoking during pregnancy also puts people at higher risk of developing asthma. Respiratory infections during early childhood during development can impact long-term lung function. Environmental exposures, such as chemical irritants during childhood or adulthood occupational hazards, also put someone at a greater risk of developing asthma. Here are some common symptoms of asthma. They may have wheezing, breathlessness or shortness of breath, chest tightness or pain, fatigue with activity, and chronic coughing either in the night or early morning, which may lead to trouble sleeping. They may or may not cough up mucus. To diagnose asthma, the physician will start with a physical examination and listen to your lungs. They will ask about symptoms, when they happen, and the duration, as well as personal and family history. They may do lung function testing, such as spirometry, to find out how well the lungs are working. Spirometry measures how much air the lungs can hold and how fast the air can be blown out. It is also used to determine the severity of asthma and how well treatment is working. Spirometry may be done before and after the use of a bronchodilator to see if the test results improve. A physician may also do a methacholine challenge. Methacholine is a known asthma trigger when inhaled, so the challenge is a test for the reaction. Other allergy testing may be done to determine if there are any underlying triggers. The physician may try out asthma medications to see if symptoms improve. If symptoms do improve with asthma medication, it is usually indicative of asthma. There are 4 asthma classifications. With mild intermittent asthma, you may have mild symptoms 2 or less days a week and 2 or less nights a month. With mild persistent asthma, you may have mild symptoms more than twice weekly, but no more than 1 time per day. In moderate persistent asthma, you have symptoms once daily and more than 1 night each week. In severe persistent asthma, you have symptoms throughout the day on most days and often nightly. It is important to know that there is no cure for asthma. The goal of treatment is to improve the overall quality of life, such as minimizing flare-ups, maintaining normal lung function, having normal levels of activity, and using the least amount of medication possible to adequately control symptoms. You'll be prescribed long-term maintenance medication to be used even in the absence of symptoms. It is not for emergency use. They help prevent asthma symptoms and will be in the form of inhaled corticosteroids or anti-inflammatories. Long-acting beta agonists or bronchodilators may be used to help open airways. They must never be used as sole asthma therapy, only in combination with inhaled corticosteroids. They may also be given oral medications called leukotriene modifiers to reduce inflammation for up to 24 hours. Anticholinergic agents may be used to help decrease mucus production. Quick relief medications are for emergency treatment. Be sure to keep these medicines with you at all times. They quickly relax and open the airways. They relieve symptoms during attack or before exercise if prescribed. An inhaled short-acting beta agonist is not to be used in place of maintenance medication. Oral and IV corticosteroids may be used for attacks or for severe symptoms. Be sure to take all medications exactly as directed, even when you feel well. Your physician may order you to use a peak flow monitor. It is a handheld device to measure airflow from your lungs and can keep track of lung function. You should obtain your baseline measurement and then test as indicated. It can show a decline in your lung function before symptoms are even felt, and you may use it to prevent an attack. Your physician may have you do allergy shots to reduce your reaction to certain allergens that are triggers, and be sure to avoid any known triggers. Here are some step-by-step instructions for using an inhaler. Take the cap off the inhaler and make sure the mouthpiece and spray hole are clean. Shake the inhaler 10 to 15 times. Put the inhaler mouthpiece into the end of the spacer if used. Inhale a deep breath and breathe out all the way. Hold the inhaler and spacer between your index finger and thumb. Put the mouthpiece of the spacer in your mouth and above your tongue. Close your lips around the spacer. Tilt your head back slightly toward the ceiling. Press the top of the inhaler to spray 1 dose of medicine. Slowly breathe in all the air you can and hold for 5 to 10 seconds. Open your mouth and breathe out slowly. Asthma triggers cause airways to swell even more. Here is a list of common triggers which may not be the same for all people with asthma. Tobacco smoke, including secondhand smoke exposure, dust mites, outdoor air pollution, pollen, cockroaches, pet dander, mold, respiratory infections such as RSV, sinus infections, or the common cold, exposure to cold, dry air, fragrances, chemical exposures, allergen exposures such as food, medicine, air, or environmental, strong emotions that can lead to fast breathing such as stress or heavy crying, medical condition called gastroesophageal reflux disease or GERD, in which acid backs up into the esophagus and may reach the throat and/or airways, which can cause irritation and lead to inflammation, and physical activity. Some people only have exercise-induced asthma, which may happen within 10 minutes or not until hours later. It is still important to get exercise to stay healthy, so it may help to warm up first. An asthma attack, also called an asthma flare-up or asthma exacerbation, happens when exposed to triggers. There will be an increase in symptoms, frequency, or severity. Your airways swell and shrink, and less air moves in and out. You will also have increased mucus, which further blocks the airways. Know how to avoid your triggers and know how to treat your asthma. Status asthmaticus is a life-threatening asthma attack and requires immediate medical attention. You are at greater risk of having another attack for several days after a flare-up. You can still live a healthy life with asthma. Avoid your triggers and follow these suggestions based upon your triggers. Quit smoking if you already smoke and avoid other smoke exposures. Use mattress and pillow covers to create a barrier from dust mites and wash your bedding frequently. Avoid outdoor activities if you are able to during times of poor air quality. Keep your house clean and prevent areas that attract cockroaches. If you have pets and do not want to get rid of them, keep them out of the bedrooms of those with asthma, bathe them frequently, and clean up pet fur often. Get rid of mold, decrease humidity in the home to prevent the growth of mold, and fix water leaks. Cover your mouth and nose if it is cold outside. And keep your asthma under control so that you have fewer or no symptoms. This will lead to improved sleep, fewer school or work days missed, and less hospital visits. If you are having to use your rescue medications more often, then your asthma is not adequately controlled. Keep track of your symptoms, the severity, when they occur, and what triggered them if it is known. Create and follow an asthma action plan with your doctor. It'll have a daily treatment plan of what to take, how much, and when to take them. It'll also let you know when to take your rescue medication, how much, and what to take. It will tell you when to call your doctor and/or go to the emergency room. Be sure to keep a list of all providers and their contact information, as well as your emergency contacts. Share your action plan with all caregivers. Prevent respiratory infections, as they can worsen asthma symptoms and can lead to an attack. Obtain flu and pneumococcal vaccines as directed. Your doctor may prescribe antibiotics or antivirals for you to keep on hand in case of an infection. Control other chronic medical conditions to help prevent asthma attacks. It also helps keep your body's strength to battle other illnesses. And make sure to regularly follow up with your doctor. And find support online or in-person groups, or with a counselor, family, and friends. Ask for help if needed. This concludes the asthma presentation. If you have any further questions or concerns, you may visit any of these websites for information or follow up with your physician. Thank you.